Our next session addresses a question on a lot of people's minds. It's one thing to improve technology to diagnose and monitor patients, or even help people stay healthy in the first place. But what about health services? How will technology alter the delivery of services that you traditionally associate with the exam room or the hospital? And what will the implications of these changes be, not only for patients and doctors, but for the business models of whole health systems? I'm thrilled to have an expert panel here that can tell us more about this concept, and if we are really heading to a hospital or clinic room without any walls. Our moderator is Dr. Jay Sanders, known to many as the father of telemedicine. Jay is president and CEO of the Global Telemedicine Group and also is adjunct professor of medicine at Johns Hopkins School of Medicine. He is a founding board member and president emeritus of the American Telemedicine Association. And he developed the first statewide telemedicine system, the first correctional telemedicine program, the first telehome care technology called the electronic house call, and the first telemedicine kiosk. Wow, busy man. Yes, he truly has earned his reputation as a pioneer in the field. It's all yours.
Thank you very much. By the way, the only reason I've done all this is I'm older than all of you. And it's so exciting to be here today to hear all the incredible technology that is now available to literally bring healthcare to the consumer. Fundamentally, we're in effect making the exam room where the patient is, not where the doctor is. And you've heard that probably earlier today. But let me underline something in that comment. It's not the fact that we can bring the exam room to where the patient is. We have to bring the exam room to where the patient is. And let me point that out to each and every one of you. My taking your blood pressure in my office is ridiculous. Literally, 1/3 of patients in the United States who have been diagnosed with hypertension and are being treated are not hypertensive. They have what is called white coat hypertension. They come in the doctor's office, they're nervous about what their blood pressure reading is going to be. Their blood pressure goes up, I take their blood pressure. My God, you're hypertensive. I start them on therapy. When they're at home, they are totally normal. Where I need to take your blood pressure is where you live and work, not where I work. Secondly, why in the world would I take the pulmonary functions of a child with asthma in my office? They're not breathing the air in my office. The antigens they're responding to are in their home, are in their school. That's where I need to take it. And to me, the most ridiculous examination that we do in our office, and Ron's going to get up here and hit me for this, and that is a sleep study. I do a sleep study in my laboratory. You don't sleep in my laboratory. Why don't I have the technology to bring that into your home? And the fundamental thing that you have heard today is that we do have this. Now, I'm going to get a little personal with you on this, but first let me say something that I think I did here today. I need to apologize ahead of time. I made the mistake after the second panel of going to the bathroom, and then I couldn't get back in. So this has probably been said already. But there's nothing here that's new. Now, the technologists don't throw things at me. I'm saying that from an idealistic standpoint. Healthcare is probably the biggest service industry. Every other service industry figured how to bring their services to the consumer years ago. You go online for your banking. You go online for your commerce. You go online for your entertainment. You can even call a local pizzeria and get your food delivered to you. But if after having that pepperoni pizza you get chest pain, what do? You've got to get up and go to a hospital ER. That's the most ridiculous thing in the world. So all we're really talking about, with all of the wonderful technology, and it really is the fact that we're finally catching up to what every industry figured out how to do a long time ago. Now, if you want to talk about a long time ago, let's take a look at my only slide. I don't know if you can see that from the back, but this is the front cover of a news magazine. Look in the upper right-hand corner at the date. April of 1924. And what does it show? It shows a young boy sitting at home at the edge of his bed with a sore throat, being examined by his physician, who was where? At his office, examining that boy's sore throat. The irony of this picture is that what is the technology that the doctor and the boy are using? It's called a radio. My God, everybody has a radio. There's one thing in there that nobody had in 1924. It wasn't invented yet. It's called TV. But think about this, and every technologist who's developing the latest technology needs to take a message from this slide. And that is, how is care being delivered? It's being delivered by the most intuitive technology that the patient, that the consumer had at that point in time. And the technology was incredibly simple. It had two knobs to operate it, an on and off switch and a tuning dial that allowed me to go from the pediatrician to the cardiologist to the pulmonologist, what have you. Who thought of this? It actually turns out that it's the editor of this news magazine. By the way, this magazine still exists today. It's called Popular Mechanics. They just changed the name from Radio News. And it's the editor, H. Gernsbach, and the H stands for Hugo, and there's got to be some science fiction buffs in the audience, because every year the best science fiction writing gets the Hugo Awards, just like you get the Emmys for TV and the Oscars for the movies. And the only difference from my standpoint between science fiction, which this was, and science is simply time. Now let's get to the personal part. I've got to tell you that, and I think I may have heard it in one of the comments today or indirectly, I need to warn you that there are absolutely no standards in the healthcare delivery system. What I need to warn you about is that you have not the slightest idea whether your doctor's evaluation of you is correct. By the way, I'm going to prove that to you immediately. I'm going to ask for a show of hands. I apologize for this little trick. But how many of you have ever had a physical exam? Please raise your hand. And keep your hands up, because the second question is, in your physical exam, did your doctor listen to your heart and lung sounds? Good. Keep your hands up. Final question. How many of you ever asked the doctor before he listened to your heart and lung sounds when he had his last hearing test? More importantly, did anybody ever ask what's between his ears? We're going to gather all this wonderful data. Who are we giving it to? Are we giving it to the right individual? In fact, anybody who thinks they have the perfect physician is really kidding themselves. None of us. I don't care how good we are, how many